Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane to answer the question of the week. Dr. Pane, this question came in from Facebook, and one of our Facebook viewers asked, when it comes to doing a surgery with a tummy tuck, lipo, and Brazilian butt lift procedure, what's the best way to go, a general versus local anesthesia? Dr. Pane, what would you suggest in this case?
Okay, that's a good question about the type of anesthesia. Now, first of all, you're talking about a tummy tuck, fat transfer, tummy tuck, liposuction, Brazilian butt lift. Usually you don't do the combination together. It varies because in Florida, we tend to separate them because of the limits on how much liposuction you could do at one time. Let's just say in terms of the anesthesia, local anesthesia for that combination is not a great idea, because local anesthesia means you're just getting the medicine, the local anesthesia fluid, maybe a pill or two. You're essentially very aware. That's a little too big surgery for local anesthesia, but it is possible to do some of these things while you are awake. When you talk about a tummy tuck, I know some people that do it under spinal anesthesia. Very few people who do it under local anesthesia, although many tummy tucks could be done. Almost always people are under general anesthesia for that procedure because you're tightening the muscles of the abdomen, and you want to be relaxed when that is being done. In terms of liposuction and fat transfer, consider that as a separate procedure. It is possible to do that under local anesthesia or IV sedation, light sedation. You want to make sure that the doctor doing it is qualified to do it. Not everybody has the privileges to do it in a hospital. That doesn't always matter 100% depending on their specific backgrounds. But in general, you want to make sure that the anesthesia is going to be appropriate for you. If you've had a previous history of liposuction, you're going to have scar tissue in there, and it's going to be harder to tolerate the procedure if you are under local or IV sedation. In that case, if you have to come back to do a general anesthesia, it's a separate procedure. So I would prefer at a minimum to do intravenous sedation, where we can increase it with an anesthesiologist or CRNA to make sure you're comfortable if you insist on being awake. Otherwise, doing it under general anesthesia pretty much guarantees we'll be able to complete the procedure, and discomfort is not going to be an issue. So just something to think about when it comes to the choice of the anesthesia. And I remind people that anesthesia is so safe these days that is really the lowest risk with almost all types of surgery. That's true in this field and in other fields as well. So just keep that in mind. Get more information with an in-person consultation and go from there.
Thank you, Dr. Pane, for taking the time to answer that question, and we appreciate it. If you have a question for Dr. Pane about cosmetic plastic surgery procedures, please reach out to us on our Facebook page or website. And Dr. Pane, thank you for your time, and we'll see you on the next question.
Great.